Okay, the patient's name is Beatrice. She's a 72-year-old female. She's presenting to the clinic with pain and stiffness in both shoulder joints. 8 weeks ago, she was diagnosed with recurrence of bilateral breast cancer and underwent a mastectomy, bilateral mastectomy. She's receiving chemo and radiation treatment twice per week, and after her last treatment, she started noticing the pain and stiffness in the shoulders. She's also having complaints of increased fatigue, some back pain, and also some shortness of breath. And she's also noticing that she's having some tingling and numbness in her hands whenever she's quilting, and also has been feeling clumsier than usual. Currently, the patient's taking Taxol via chemoport for chemo treatment. So with that, we know that she has possibilities of having neuropathy and maybe some cardiovascular compromise, maybe possibly arrhythmias and some abnormal blood pressure. So monitoring blood pressure, heart rate, and also fatigue levels for sure with that. She's taking Zofran for the nausea from the chemo. Could cause some drowsiness and maybe affect her gait and balance and things like that. She's also taking some Prevacid for heartburn, nothing too concerned about. Also taking Metoprolol for angina, so that goes back to assessing heart rate and blood pressure and anything that we could feel could lead to cardiovascular compromise. She's also taking Moniva for osteoporosis. So with that, there's also side effects of musculoskeletal pain and things like that. So something to be aware of. And she's also taking Colace, so just making sure that she's near a bathroom during therapy in case she does have a bowel movement from that. So as far as lab values go, prothrombin and thromboplastin were within normal limits. INR was slightly high, so we definitely monitor for any cardiovascular compromise there with family history of CVA. And all the others are RBCs, hemoglobin, hematocrit, white blood cells, and platelets were all low, which is typical with chemotherapy. So, and radiation, so that's something we want to keep an eye on, making sure that we're monitoring for fatigue. She's also increased risk of bleeding with the platelets being low, anemia with the RBCs and the hemoglobin being low, and she's also at risk for orthostatic hypotension and maybe some tachycardia, so we're going to make sure we're monitoring O2 perfusion there. And she's also at risk for increased infection with the white blood cell count being low due to the suppression effect of the chemo. So with imaging, also all of it was done with bone scan and x-rays. So as far as ruling out adhesive capsulitis, typically we'd need an MRI for that. So it's hard to say that that's going to contribute to the pathology, but right now, right and left shoulder were negative for any bony abnormalities. But one thing to consider was that the chest x-ray did show a nodule on the right lower lobe, so definitely monitoring the pulmonary system and any effect that it could have on progression there. So some of the yellow flags, she has osteoporosis, maybe more of a red flag depending on how far it's progressed, but some of the bilateral shoulder pain and stiffness, the right lymph node removal 4 years ago and the left TKA 2 years ago. These are definitely things we want to keep an eye on whenever we're doing any type of therapy, because they may be affecting some of the movements and things like that, and also as far as mobilizations are concerned with osteoporosis. As far as red flags, she had double mastectomy. She's also getting chemo treatments right now with radiation. She's been having shortness of breath, fatigue, and with the imaging, we also have the nodule on the right lower lobe, so that's definitely something to consider, and also just monitoring the clumsiness and tingling and numbness she's having from sensation changes. So some of the risk factors and comorbidities that could be affecting her outcome is definitely going to be the increased fatigue, the back pain, the numbness and tingling in the hands, the decreased range of motion in upper extremities, and also the chemo that she's going through right now. Those are all going to be risk factors that we need to pay attention to. So monitoring cardio and respiratory systems there, and also some of the sensation and things that could be affected by that chemo that she's undergoing. The comorbidity, she has GERD, osteoporosis, which is one that we definitely want to be careful when we're doing any mobilizations. Urinary incontinence, which could also increase the chance of infection, and hypertension. That's going to also just play into that cardiovascular system that we really need to keep an eye on, and also just mainly the effects of the chemo and radiation itself. So contextual factors, she's married, she has 3 sons that live locally, and they can help her out, so that's a good thing for her prognosis. She lives 25 miles outside the city limits, so that's kind of it could be a problem as far as getting 2 therapy treatments. Sunken living room, so definitely going to have to try to evaluate how we can handle that. She has grab bars, and bathrooms and shower are wheelchair accessible, so that's definitely a big plus. She doesn't have any DME right now, so we're going to make a assess for an assisted device. Single story house, doesn't use tobacco or alcohol, and she worked on a farm prior to treatment, so that's definitely going to help her as far as prognosis. So system list, we're going to definitely start with cardiovascular and pulmonary with everything she has going on with the right lower lobe nodule, as well as all the blood levels being low and the chemo. We definitely want to keep up with cardiovascular changes, so checking for fatigue, shortness of breath, heart rate, blood pressure, all these things that we need to monitor, as well as respiration rate and heart and lung sounds. Neurological, making sure that we're monitoring any changes in sensation due to neuropathy, so making sure we're keeping an eye on that with progression, and also MSK with all the joint pain and stiffness she's having, so monitoring that as well. Just trying to keep an eye on joint mobility and any other changes that could be occurring with that, and also just checking psychological because she's at risk for depression and anxiety, so giving her questionnaires and trying to monitor any signs of that. So for the pathology, I don't think that it's actually adhesive capsulitis. I feel like we need more imaging and other things to prove that right now. I think maybe some of the joint pain and stiffness that she's having in her shoulder is going to be a result of the mastectomy, and maybe some scarring and other things that she has from prior surgeries that are contributing to that. So, and also maybe just being in that rounded position after surgery that's kind of got her stuck more forward. So one of the things definitely want to try to work on is just strengthening the shoulder and trying to get some mobilizations, but also being aware that she has osteoporosis. So we're going to try to consider all these things and try to increase some of that scar tissue mobility in order to improve some of the upper extremity range of motion and function. So her prognosis, I feel she has a fair prognosis to be able to work on her family ranch and take care of her animals like she wants to. And I feel like she can do this with a decrease in fatigue and pain, and probably accomplish this within about 12 weeks with participation in physical therapy. She's motivated and she's trying to remain as active as she can at home, helping on the ranch, and she has a lot of support from family, her husband and her three sons. Chemo and radiation treatments is definitely going to impede the recovery process. There are going to be a lot of ups and downs with this, but with her participation in therapy, I feel like she is likely to experience a reduction in pain and improve cardiovascular function and be able to take care of things around her house.